Good afternoon or a lovely evening to everyone. Welcome to City of Hope's virtual career fair with focus on healthcare IT opportunities at City of Hope. I'm Shella Serena-Gaor, a business recruiter here in the Department of Human Resources at City of Hope, and I will be facilitating the session this afternoon. I'd like to go around the room for a panel to introduce themselves. If you can say your name, title, department, how long you've been at City of Hope, and also add if you were previously a clinician.
My name is Hugh Pham, and I'm a senior system analyst for the electronic health record. I've been at City of Hope for 3 years, and I have a nursing background.
My name is John Hillis. I'm a CIS senior systems analyst, EHR, for the CIS revenue cycle team, and I've been at City of Hope for 7 years.
My name is Lori Parisi. I am a part of the clinical informatics department and work as a senior clinician adoption analyst. I have been at City of Hope for 5 months and I have a nursing background.
I am Ruby Johnson-Long. I'm a clinical design architect. I'm part of the clinical informatics team. I've been at City of Hope for 3 years and my clinical background is registered nurse.
I'm Jason Aranda. I'm the Director of Clinical Applications. I've been at City of Hope for over 3 years now, and I have a nursing background.
Okay, well, thank you everyone. And before we start our discussion, I'd like to remind all that you can participate in our discussion or submit your questions on Twitter using hashtag City of Hope. Twitter using hashtag CIS City of Hope, or find a Google Plus at the bottom of the screen. I'll repeat this again later on during the session. Click on the yellow or gold Google Plus icon at the bottom so you can submit your question. This is a 1 hour session and we will be reserving the last 10 to 15 minutes to answer your questions. Okay. So again, I'd like to differentiate the clinical informatics teams are represented by Lori and Ruby on this side, and CIS is represented by Jason, John, and Hugh on this side. Okay. Do note that this is being recorded and will be available online on City of Hope's YouTube channel. If you cannot join us for the entire hour, please check the full video or share with your family or friends who may be interested in City of Hope and healthcare IT careers. Our main topics will be the following. What is CIS, or City of Hope Information Systems? What is clinical informatics? What do employees in these teams responsible for? What education or experience do you need to get started on these careers? And why City of Hope should be your preferred employer? If everyone's ready, let's now start our discussion. I'd like to ask Jason, as the management representative of CIS, to talk high level of what CIS does at City of Hope.
Sure. The CIS program, as Shella alluded to, stands for the City of Hope Information System. It's a program, it's a strategic initiative by City of Hope to transition us from a paper-based model to an electronic system. And in that transition, it's not just transitioning our paper processes into an electronic format, but looking at it from a more sort of holistic approach in terms of what can we do as we get more data. So because we are a research institution as well, we look at our data as what can we do with it in the future to mine and provide actionable data for City of Hope. So it's a program, and we have an army of people, and because with any electronic health record implementation, it takes a village of people to implement that. And by that, what I mean is we have different groups of personnel that provide different specialties or knowledge base to our program. We have a clinical informatics team that looks at workflow. We'll look at design, work with our stakeholders, and in this case, in our institution, that's working with our front-end clinicians, whether that's providers, nurses, mid-levels, and assisting, looking at what their current state is, and really defining and in some case, even refining what the future state would look like. As an adjunct to the clinical informatics team, there is a group of clinical analysts and programmers that look at the configuration side. So we here at City of Hope, our vendor at the medical center is Allscripts, and Allscripts provides us with configuration tools that we can use internally to make changes to the software to align it more with the City of Hope workflows. And then as part of an integrated system that we have, we don't just look at it from a clinical perspective. Within the CIS program, we also take a look at the patient financial and revenue cycle type of workflows and what they could use from an integrated approach. We also have developers and programmers that can do custom solutions within the software, and report writers that can extrapolate data out of our EHR.
Okay, thank you very much, Jason. And our clinical informatics director, Janet Muno, cannot join us today, but she has this to say about her team. And actually, Jason, thank you very much, because you touched on a lot of these as well. So the clinical informatics team is different from CIS as they coordinate and engage clinical groups. These are physicians, nurses, pharmacists, and other health professionals within City of Hope, as well as operational leaders, to ensure that the design of City of Hope's electronic medical records, again using the system Allscripts, meet their need and ensure patient safety. This team bridges CIS systems analysts and the clinicians. So the clinical informatics are crucial really in bridging the systems analysts and CIS and clinicians. They evaluate and analyze workflow and recommend enhancement to improve clinical processes. Clinical informatics analytics also facilitate the understanding and use of clinical data to optimize clinical processes and build clinical decision support tools to enhance decision-making in the clinical workflow to improve efficiency, patient satisfaction, quality of care, and health outcomes. Now let's hear it directly from the staff, what the difference is between clinical informatics and CIS. And I'll start with a clinical informatics representative, Ruby. As a clinical design architect, can you tell us what a normal day looks like for you?
So my normal day, majority of it is really taken up with design meetings. So I'm meeting with stakeholders or operational leaders and some end users to find solutions. So we've gone live with the CPOE, that was about a year ago. So there's a lot of enhancements that they want to do, and there's also some issues they'd like to kind of streamline as well. So a majority of my day is taken up with meetings, just trying to come up with solutions. So that's with the stakeholders, and also meeting with the analysts and the builders. Trying to find again the solutions and just kind of what would you call it, brainstorming. There's a lot of very intelligent and productive use with those meetings. So the other part of the design role is also we provide support, end user support. We have rounding as a part of our role. So we have daily rounding. So we split it up within our team, and we actually go out to the floors and work elbow to elbow with end users. So being a clinician, we're in touch with their workflows in that aspect. So yeah, in a nutshell, that's about.
So it sounds like you do training too for the clinicians who use the system.
Yeah, sort of elbow to elbow training. It's not the formal training class. We have a training team that does that. But with informatics, it's more honing in on their workflows because we're familiar with their workflows, and because we're out there. We can provide, just in time training, that sort of thing. Or if there's any specific training needs for each department, which Laurie will probably touch on a little bit later on with that, because she's involved with specific, what would you call it, divisions. So clinicians are physicians, nurses, physical therapists, all the ancillary groups. We've been assigned to specific divisions, so we're familiar with their workflows.
So City of Hope's a cancer research hospital. Does the CIS and or clinical informatics touch the research side as well, or is it mainly the hospital?
Research is embedded within it because all of the patients who are on research protocols actually will go through the outpatient, inpatient. They'll be touched by all the clinicians. So, any patient can be on any research protocol. So it's actually embedded in a lot of their workflows. And that's something that we're trying to include and enhance as well. So we have order sets, which are always changing, I think, with the research protocol. So it's always like this, what's the next research protocol? We have to include that into their workflow. And right now we're getting up to speed on including that.
And I think that's why it's important to understand that, because even though we implemented Allscripts last year, or it's been more than a year, that it's continually evolving because we're enhancing it based on our needs, right? Okay. Well, let's go to CIS and let's ask you over here. What does your regular day look like as a senior systems analyst in electronic health records?
To break it down, it's pretty much it's very simple. You have support of already live functionality, and then you have the development side. And within the Allscript application tool, it has a different module that what's the word, that does different functionalities. So for the items that's already live that we've been a year, sometimes there's enhancement requests or there's some issues related to upgrades or version, so on and so forth. So basically all my work, we address that as high priority. And then of course there's new projects that are rolling out. So you also spend time working on those projects that our team, each one takes a bit of the big project and work on it. So, in the scope of those two facets of the day, support and development. So you meet with like Ruby had alluded to, you meet with your colleagues to come up with the best solution. On our team, the challenge is to provide Ruby with all the options that are available first, so that she can present those viable options to the stakeholders, so then they can make a decision based on the workflow that's present. So that requires meeting with our colleagues, attending meeting and schedule and unscheduled meeting, so on and so forth. And we also have a tool that tracks all of the workload that comes in. So we try and do that, go in and manage all the tasks that's been assigned to us, so that if the task gets transitioned to someone else, that they would have the adequate information to carry on. So basically the whole day revolves around that. And the one thing that I want to say is that the job really allows you a lot of flexibility, so it's never boring. So you have the opportunity, you collaborate with your manager to prioritize your work, and so you decide what's the most important, what's the high priority for the day. So it's always very unique, and it's never routine. So.
Sounds like a good day. So John Hillis is part of the CIS team, but he does something different. How is your role different from you, for example, as a senior systems analyst as well?
It's similar in some ways, but it's also different in what we support. We do what's live now. We support what's already in the system, and then we also support any enhancements or any changes that are coming to the system for the different areas that revenue cycle supports. So for example, under the revenue cycle umbrella, there's the registration system, which is Allscripts registration. We have Allscripts scheduling, and we also have Allscripts financial manager, which is the financial system. So right now we currently support the current functionality for each of those systems. We also support any upgrades which are enhancements to systems. We also work with the users and the operational folks to talk about what they want the system to do that it currently doesn't do. And then we try to see if there's any way that we could enhance the system to meet their needs.
So Hugh's team, at least, or Jason's team, handles inpatient, outpatient, or is that the case?
And we also support
we also do inpatient.
we support with revenue cycle, like for example, the registration system, it's inpatient and outpatient. The scheduling system is outpatient. They only schedule outpatient visits in that system. But the financial system, they bill for inpatient and outpatient. So it kind of brings everything all together at the end.
Okay. Sounds good. And people were talking about enhancement. Are there any major projects that we can share, Jason, to our viewers today?
Well, a lot of our enhancements have to deal with there's meaningful use requirements that are federal mandates from the government, and as you go through the different stages of meaningful use, you have to configure the system to match that. There is also your regulatory changes, whether from the Joint Commission or anything that based on other regulatory requirements that come up, we have to configure our system to meet those needs. The other aspect, and I think Ruby touched upon that, is also we are a very research-oriented organization. And so we have to make changes to our system based on whatever research we're doing at the moment. We do various clinical trials, and we have to have a system that's able to accommodate that. So.
And Ruby or Lori, are there any clinical informatics projects that we can also share?
I think the big one is just the islet cell transplant. So Lori's been involved in that one. Yeah.
So if you can say that again, what
Islet cell transplant.
Okay.
So it's IRB is building order sets for the islet cell transplant protocols and all the trials that are out there. And so we just went live with our first one, and we're waiting for the patient to come. So it's going to be exciting. We get to, the informatics side gets to work directly with the nursing and the providers, as well as pharmacy. So we're truly a link to everybody and kind of guide the workflow processes that happen with IRB. We're excited.
Okay, so no patient yet that's been entered in the system, and that's also all scripts, right? Okay. Well, let me tell the audience actually that there are several openings in CIS for the role that Hugh and John are doing. In John's team, for example, there are 2 openings, and I'll talk about that more towards the end of the session. And for CIS, systems analysts, there are different levels that we're hiring for. We're looking for people who have 0 to 2 years of experience, 2 to 5, and 5 years. So we're talking, entry level, mid-level, and seasoned senior systems analysts in all scripts. Now let's learn how our panel got started in their healthcare IT careers. John, I hope you don't mind if we go back to you.
I don't mind.
That's so soon, I know, but not having an RN background, everyone around you has an RN background, but you were able to get into a healthcare IT career job. Can you tell us, how your role evolved, how your career evolved, and where you are right now at City of Hope?
Well, my healthcare experience started on the operational as a user side of it. So I started as an outpatient facility many years ago, working with different registration systems and scheduling systems, and even a little bit of clinical as a user. But when I came to City of Hope, I came here as a manager in health information management. And when I transitioned to City of Hope, we were in the process of going live with all scripts. So as a operational person, you're also a part of the design aspects of it. So I worked closely with IT, and I realized this is something that interested me, the design part, the problem solving part, the troubleshooting part. So when an opportunity came up in the IT team, I went for it, and I've been happy ever since.
And that's what people need to understand. You may be on the other side, people that Ruby and Lori are now meeting with, but now they want to transition and learn how to build, and that's how you transition into these roles.
Yeah, the operational does work well when you're doing the technical side. I mean, it's neat because you kind of understand what the user's workflow is. You understand what, you kind of get an understanding of what they need, what their workflow is, and then you have a better understanding of putting it all together and add in the technical piece.
Mhm. Did you have to go to attend a technical course maybe?
Most of it was hands-on training,
Uh-huh.
especially for here for Allscripts, when I was supporting our document imaging system, for example. I really was involved in I was involved with the understanding what the configuration was, what the troubleshooting was. As being a manager in that department, you kind of have to understand how everything plays together. So I just kind of learned it, and then when I joined ITS, it was a little bit more training, going to training classes through Allscripts, configuration training, but it's been very rewarding.
So those training were actually paid for by City of Hope? Was it provided for by City of Hope?
Yes. Mm-hmm. Yes.
So what point did you decide to, I don't want to be on the other side, I want to do healthcare IT? What clicked?
I think with me, when I joined IT, to me the day's never the same. I'm always learning something new every day. It's not monotonous from day to day. With this, I'm learning something new. We all learn together. I mean, even though I'm not clinical, I learned the clinical side because it kind of connects with the revenue cycle side. So it's just you keep learning. It just keeps evolving.
Okay, thank you, John. And let me go to Lori. Being a part of the clinical informatics team, can you tell us how you transitioned from a bedside nurse to a senior clinical adoption analyst?
Well, to say first off, it was very scary to make that change, but it was the best change that best decision I've ever made. Starting with a background in critical care nursing, you get a chance to really learn a lot about what the provider's role. You work with multiple different ancillary departments in the hospital, and all of the organizations that I have worked with have given me the opportunity to be a super user with the system. And it just happened to be that I was a super user for Allscripts, and working through the first year as a super user, just very interested in how can I help the organization build better workflows. Analysts need clinicians to help them understand what clinicians do to build. And so we're kind of the link to them. And the more I got involved, I just kept with it and decided to apply for a position. And now I've been in the clinical informatics role for the past 3.5 years. So.
And John, how long have you been in healthcare IT?
In healthcare, I've been in IT for 4 years.
4 years.
Yeah, but I've been at City Hope for 7, so 3 years I was in more of the end user role, and then 4 years in IT.
Is there anything else that you'd like to add, Lori? Yeah. And I'd like to go to, and I'll actually ask everybody, how you transitioned from your previous career to your career right now in healthcare IT. So let's go back to Hugh.
Well, my story is kind of like what John has said, right? It's just when I worked a different role at a county hospital, previously to this, and there's certain repetitive tasks that you kept doing over and over again, and then the application came out and said, hey, you have a way to automate some of these things, and you can also track and do historical data, that kind of thing. So it's very interesting. So I was fortunate enough that my old organization gave me an opportunity to oversee or help implement those systems, small systems, like dealing with acuity, scheduling, and just the ADT system, right? So I started out from there, and then another opportunity came up. I decided, like Lori, to delve deeper into the application, because that was when the EHR, EMR was fairly new. So an opportunity came up, so I decided to just apply for it. And I think everyone here on the panel has already referenced that, is that what's really valued within the role is that knowing the workflow. Because if you have clinical background, especially for working into the health electronic health record, it really helps because it's no more, the technical side is a little bit daunting, like what Lori had said, but it's no more difficult, no more different or any more difficult than the clinical side. You know, when you're dealing, I came from a nursing background, so when you work on, deal with sick patients, so on and so forth, you know, on the technical side, you can learn it, but the workflow is the key. And I think we have all alluded to that here, that knowing the workflow is invaluable because that's the experience that they really want you to have, to understand or have the ability to learn. And then once you have that down, then the technical things you can learn either on the job or by training. And I've been, like John, I've been fortunate that City of Hope is really very pro education, encourage you to continue education. And our CMIO has set up meetings to help us educate about the big picture, so on and so forth. So City of Hope is really, has been great in allowing us or encouraging us to have, to take advantage of those opportunities that come up, so.
Okay, thank you. And Ruby, you know,
My introduction to healthcare IT, I'd been working in ICU in the previous organization, but it's, you know, I loved it, but it was very physically challenging, you know, very heavy patients and just the strain of it. So I was kind of looking around for different opportunities at the time, and I was reading a job description on clinical informatics, and this was 7 years ago, so I'm showing my age here. But it just, the job description just sounded wonderful, and I was just thinking, wow, I want to be involved in that, you know, in mostly design work. So they needed somebody with strong clinical background, and so I talked to the manager, and he inspired me to join the team, and that's pretty much where I've been since. So I've been involved in a lot of design, but also in that previous organization, we did a lot of building as well. So we were sent to classes with all scripts, so just the configuration side of it. So it's very user friendly. I think if you have, you know, a general sense of I don't know how you would call it, just a general sense of curiosity and just to learn a new thing. It was exciting to be involved in the build aspect and to understand, I think, how systems are built, and also applying our clinical knowledge. It was just wonderful to be able to produce a product. So I was involved in clinical documentation build. So to go from paper to something electronic and knowing how, you know, how nurses and physicians need to interact with that was really exciting to be, you know, involved in that sort of thing, and to enhance the workflows as well. At first, they're kind of pushing back and saying, you know, this is much harder than what we do on paper. You know, paper is so much easier, but in the system, you know, it's once they get there, they're like, oh, this is wonderful. You know, I can see now, I can read. So.
But you can also say, look, I was a nurse too at some point, and I think there's a lot of benefits to really doing it electronically, and you know, so that background really helps. Was it scary for you too, just like what Lori said? It was a scary move for her.
It was, because I think I wasn't used to being in front of the limelight and, you know, and running meetings. Because as a nurse, you're pretty much, I suppose you're not really running meetings. You're dealing with, you know, people on a one-to-one basis with physicians, et cetera, and other clinicians. So in clinical informatics, you know, have to group people together. You have to run the meeting effectively, and kind of you have a purpose to the meeting, and you want an end point at the end of that meeting. So, and also following up. So it's pretty much project management that you're having to learn as well. But it's very exciting to be involved in that. You know, like you said, it's never boring. So there's always something new coming up. And City of Hope, you know, it's very exciting to be involved in a lot of the research protocols. You know, you don't think that there's possibilities out there for these things. There's wonderful people that work there. So.
Okay, and it looks like with clinical informatics too, you not just have to have clinical background, have knowledge of the workflows, but also have that personality to be in front of people and engage a lot of people, because you do a lot of influencing, right? You know, you can't always just take in what the physicians or the nurses says, but you also have to be able to influence them based on what you talk to the systems analysts. This is what we can do. This is the limitations of the system, right? Does it work that way? Or?
It's probably presenting them with what's possible, but you know, presenting them with things. Probably, I suppose they can open the world up to, you know, anything. I want, you know, the electronic system to do this, this, and this for me. A lot of the times you kind of have to drill down and say, you know, do you need really an electronic solution, or is it really a workflow that we need to kind of look at? And, you know, if it's a broken process anything electronic that we layer on top of that will highlight that broken process. So we need to look at your processes. So that's part of the clinical informatics, I think, that comes in key. We have to really look at the workflow. So one of the things I think I was just involved in was infusion areas. They had difficulty with orders. They were missing orders, and they'd said, "Can somebody please come to our clinic and just sit, for a couple of hours a day and see how are we, what's our workflow? How can we improve this, etc." So just by sitting there, we kind of, we sat in that one clinic, infusion clinic, and then another infusion clinic, and kind of compared what was working in one versus the other. And I think really it was a workflow rather than an electronic solution. We were looking at, maybe actually came up with the idea themselves. Maybe we can do some, what would they call it, prep work before we go in, before we start the day, and then actually set up their workflow for them. So that was kind of the interesting thing with informatics, it wasn't an electronic solution, but it was enhancing the workflow.
Yeah, business improvements, business process improvements. Yeah. That's good to know.
And what I just wanted to add was, as I listen to the panel here, and including John, is, in healthcare IT, it's truly becoming an industry. And, for the people that have a clinical background, you can look at healthcare IT as another specialty. There was before, it was sort of a non-traditional route to get out of the bedside and then go into something like healthcare IT. But nowadays, it's becoming truly a specialty. It's just like when I talk to other nurses and new grads, we talk about how nursing is all about finding your niche, right? Because there's so many avenues you could take your nursing career on. And so healthcare IT is just one of those where you could specialize and hone in. And so just because you're in this industry doesn't mean you're not a clinician anymore, right? Every day, the clinicians that you see here, and on the team, there's other clinicians. We have PharmDs, we have pharm techs, we have clinical lab scientists, and they use that knowledge and that science that they have, the background that they have, into what they do every day. So it's no longer, I used to have a former employer who used to call me a former nurse, and I used to just gripe at it and say, look, I'm not a former nurse. I still have my license. So I think that's one thing to kind of point out here, that everyone here are still licensed professionals working in an industry, and others can join that industry, like John, who doesn't have the bedside background per se, but he does have the clinical HIM component that he brings to the table.
That's true.
That's right. So does everyone maintain their clinical license? Is it required by CIS and clinical informatics?
Yes.
Oh, okay. Well, we were going to go to you, Jason, and ask you how you transitioned.
How long do we have?
I think we still have plenty of time.
Okay. Well, I was I have a nursing background. I was a critical care nurse, and as a nurse, I think I was frustrated by a lot of the repetitive tasks that I had to do, and saw an excellent opportunity while I was traveling. I was a traveling nurse as well, and I was able to touch on different systems while I was traveling. And in that process, I was connected with a vendor, and I actually started working for a EMR vendor first. And in that capacity, I was able to see sort of the software side of things. Was in various capacity, I would either work with a sales team and help them bridge the gap that they have from trying to sell their product. But part of that is being able to talk to the clinical community about what the product can do. And so I did a lot of that. I was working in a clinical analyst capacity too, as we sold the product, we needed to implement it. So I was a part of the clinical team that was implementing it. Back then, I guess showing my age as well, and with that software vendor, I don't know what it is now, but I was actually the only registered nurse in that software company. And so a lot of the clinical knowledge was, I was helping bring and infuse into that company. And then after working for a software vendor, I had an opportunity to work for an actual acute care setting where they were actually considering transitioning to an EHR. The interesting thing is, years ago, it's only been very recent that with the federal government mandating electronic health records that we saw this, trajectory of healthcare IT being really popular. But back then, prior to meaningful use, a lot of hospitals did it because they felt it was the right thing to do. And so it was a different mindset. And I was fortunate enough to get connected with an institution that was looking to do that because they felt it was the right thing to do. And I helped them from the selection to the actual implementation. So I went through a selection process, helped them evaluate multiple vendors, went through an RFI and an RFP process with them, really formalizing the selection process. And then I was tasked after that to build a clinical informatics department. And so it started with a team of 1, later 2, and then it started to grow and really build it from the ground up. And then after that, I've worked with other institutions, helping them with EHR implementations before landing a position here at City of Hope, helping them with their EHR implementation as well. And so my transition has been, you could say, from the bedside to the software to now being at the actual organization side. And so I've seen both sides of the equation.
That's a great story. I mean, it sounds like you're a pioneer. Like you build these EMRs. Like you said, you don't have just experience with Allscripts, but other systems as well.
Yeah.
Okay, great. I'm glad we asked him last about his story. I can't beat that. Why did you join City of Hope? I think we'd like to share with everybody. And before we do that, we would like to remind everyone that you can submit your questions and join our discussion on Twitter using hashtag CIS City of Hope. And you can also use Google+, which is at the left bottom of your screen. You can click on that and submit your questions. And again, join our discussion. So the next question is, why City of Hope? Does anyone want to volunteer? John?
Sure. Well, the reason why I was interested in City of Hope, I really, well, just personal background. There's a history of cancer that runs in my family. So I thought wanted to work at City of Hope because I know it was a cancer specialty hospital. And I wanted to work at a place that maybe I could make a difference in somebody's life. So when I joined City of Hope 7 years ago, it's been, every day since I've worked here and every day when I leave, to me, it's been very rewarding because I feel like I'm making a difference, whether I was working in, health information management to working in ITS. To me, it's all for the common good, which is to bring the best care for the patient. And I feel like everybody here, everybody on this team, that's what we do. And to me, it's been, very rewarding. I feel I work at a place where my opinion matters, where my feedback matters. No participation is never considered negative. Any feedback is always welcomed. No idea is a bad idea kind of atmosphere. And to me, I leave here every day happy.
That's good to hear. I'm hoping that William will get a 5 in his engagement survey with the team. Yeah. We do an engagement survey here at City of Hope. And, it looks like John rated us all 5s. And Lori, would you like to share why City of Hope? Why did you move from another hospital to City of Hope?
Well, previous organization was primarily an inpatient organization, and here at City of Hope, it's inpatient and largely an outpatient organization. And once you're at an organization for a while, I was there as a critical care nurse for most of my career before I transitioned over. This was just an opportunity to continue to grow. to work with a bigger organization. They offer the opportunity for education reimbursement. And you're working, again, with Allscripts, something I'm familiar with. And it's a nice team, working with other nurses, probably more nurses than at the previous organization, and just a chance to grow. And you get to a point in everyone's career where you kind of just need to branch out and learn something different. So I'm very happy here.
Well, thank you. You've been here
5 months.
5 months. Happy to have you here. And Ruby, is there anything that you'd like to add to that? Why City of Hope?
I think the other thing too for me, I mean, I kind of echo Laurie's and John's sentiments about it, but the other thing too is it's a very inspirational place to be involved in, you know, with all the research and just the cancer treatment, to see that there's the clinicians that we work with they really have big hearts, you know. They truly care about their patients. I mean, you know, just at the end of the day, they can be, you know, kind of grouchy with you, kind of saying, you know, this system is not working the way you should make this easier, etc. But when you see them with their patients, it's so inspiring that they truly, truly care about their patients and they would do anything for those patients. And, you know, they could be, I mean, I've been in some offices and they've been chaotic, you know, with paper charts everywhere. And I just knew with this electronic system, that would just ease all that load. You know, everything they need is at their fingertips. They don't have to depend on those paper charts. So I was lucky enough to see what it was like beforehand when they were on paper to now what they are, you know, 2 years after I've been here. They've been live with CPOE for a year and they're so portable with everything now. So it's nice to be able to, like Laurie said, to be involved in that growth. Like you see them pre-CPOE, now you see them CPOE, and just to be involved in that whole project. At my other institution, CPOE was already live by the time I joined the team. Here it was just its, you know, infancy. So it was just nice to be involved in that and exciting to be part of that. That's why I kind of thought, you know, it's nice to make that transition. It was kind of scary to move from a place that I'd been in for 10 years into, you know, a brand new place. But, you know, after looking to it and thinking, wow, you know, and the other thing too, City of Hope, it's, we do a lot of custom stuff with Allscripts. A lot of people who've come in, like consultants, that they come in and they say, this is really not the original Allscripts product. You guys have, you know, massively improved this, or, you know, you've really customized this. So that's the beautiful thing about City of Hope. We, you know, we really look at their workflows and say, how can we enhance this? And we have, you know, a great team of analysts and developers that work wonderful magic with the product and can do a lot of things, you know, to help the clinicians. So, yeah.
You mentioned CPOE. For those who don't know what that stands for, can you tell us what CPOE stands for?
Computerized physician order entry.
Is it physician?
Provider.
Order entry, yes. And would you like to share why we should encourage people to join City of Hope?
Sure. And I hope the rest of the team doesn't laugh because my answer is a two-parter, right?
Bullet points, okay?
So why did I come here, right? And the second part is why am I still here, right? So why did I come here? Well, I think to come here, it seemed like a great fit at the time 3 years ago. And it was more for selfish reasons. You know, it was closer to my home. And I mean, I think compensation was great. So can I complain there? So after that, the 3 bullet points I want to highlight why I'm still here, because that only takes you so far, right? Those 3 things at the very beginning, why you come and then why you stay. I feel like within our CIS team, there's a spirit of collaboration in working toward a best EHR solution for our care providers in providing care for our customer. After all, everything that we do here is for the patients, right? If we don't have any patients here, then, you know, it's all for naught, really. So that has to be our main focus. And I also feel privileged. Well, I am privileged to be part of a team of engaged and dedicated professional, like what Ruby was saying. Got really great people here. So, and the last thing is that additional benefits include pleasant working environment and supportive management, right? So I really like that. And I have to say, a lot of props to Jason Aranda because he really embodies that supportive management. So
That's great.
I didn't have to pay him for that.
Well, thank you everyone for really touching on why you're here, because I think it's very important. We're mission centered, right? And we also I talk to candidates a lot about values, and you all talked about that. You know, Ruby and Lori talking to providers talked about compassion, you know, intellectual curiosity. You can hear from all of you how curious you are to make improvements to those workflows, right? You talked about collaboration, service with a sense of urgency. Well, we talked about scheduling and not scheduling, but I think it's very, on scheduling meetings, but it's really important to note that all of you feel that you're there to support the clinicians who provide that urgent care to our patients. And excellence, all of these again exemplifies excellence. So thank you very much.
Yeah, and I think as I listen to the group here, you know, it really boils down to the mission statement of City of Hope, right? And it's hard to explain. It's you really have to work here to experience what they're saying. Is other institutions talk about mission statements. I know I've been part of many institutions that mission statement is something that's out there that you recite back. But here at City of Hope, what's truly unique is people truly do embody the mission. And you feel that every day as you work here. And I think that's what everyone's trying to explain. And you can't really, it's hard to explain, and you have to just work here to kind of realize that.
Thank you so much, everyone. You inspired me today. What City of Hope is looking for right now, we have about 10 openings, 10 that are open right now, and 6 that may be opening soon. We are looking for people with clinical backgrounds, as we've mentioned, you know, RNs, and we're nurses actually. So we're looking for LVNs, your licensed vocational nurse, registered nurse, nurse practitioners, even physician assistants, pharmacists, pharmacy technicians. And so I thought pharmacists was hard to find. It's even harder to find clinical laboratory scientists who are into CIS and informatics. So we're definitely looking for those. Those are our priority, but we are also looking for people who are technical, have real technical background, no clinical background, but who have been in the healthcare industry or medical groups, so they have that knowledge. And so I would encourage everyone to join me on LinkedIn. If you can connect with me on LinkedIn, I'm probably the only Shella Serino Gaor that you can find on LinkedIn. And you can also find me at Twitter, connect with me on Twitter at SGAOR. And you will learn from there. And of course, our City of Hope Careers webpage, you can learn from there all the openings that we have between CIS and clinical informatics. We are now open for questions. Again, we would like to know what you think about the discussion. And if you have any questions, you can submit it through hashtag CIS City of Hope. Again, that's hashtag CIS City of Hope through Twitter, or you can click on the bottom left of your screen. There's a Google+ sign. You can click on that and submit your question. I have a question here actually. And I'll share it with everybody, and I'll probably have at least 2-3 people talk about it. We have an ROP program here at City of Hope, and I think it's very important to prepare and get a pipeline of people. Being a recruiter, I know how hard it is to find people with enough experience. You talked about 7 years, 5 years, 3 years. Sometimes we're looking for people with more experience than that, with more years of experience than that. What can a high school student do to prepare? How could they start early and prepare for a healthcare IT career? Jason, would you like to start?
Yeah, I mean, the nice thing about the healthcare IT industry now is you do have sort of a clear path into the industry. And I think that clear path is, you know, first of all, it pays to have some clinical experience, right? Being at the bedside, because that's truly where your value in this industry comes in, because you can speak the clinical speak, And from a technical component, you can speak the technical speak as well. And so my advice is to get bedside experience. There's a saying, an old CEO of mine when I was working in a software company, and I asked him the question, why are you hiring me? I was the only nurse at that time. And he says, well, I've realized I can train everyone on the application, but I can't train them to become a nurse or become a clinician or become a pharmacist or and so that would be my first advice, is just get the experience at the bedside and learn workflow, understand sort of what you do in a day-to-day, and kind of look at it from an intuitive mindset, like, because I'm doing it, is that right? Right? Is there something I could change? And I think that's where it starts.
Anyone else? Maybe John, from the patient revenue cycle, what do they need to do as a high school student? What do you need to get ready for?
I think to add on to what Jason said, I think experience is important, and also previous experience in the field is important as well too. So getting your foot into the door into a healthcare type of environment is a big plus within the future.
And more institutions, colleges and universities are providing specialties into this field now. And so I would also recommend looking at that. If you're in nursing school, informatics is now more and more becoming a huge component of the program. If you're in pharmacy school, they're also trying to integrate that as part of the program now. And if you're a post-grad, graduate of nursing school, you can get master's level degree in informatics or in healthcare information technology as well. So I would highly recommend looking at those avenues as well.
In fact, I've seen those with our candidates, a lot of people with masters in informatics. I forgot the question. I had something in mind. But do you still prefer, of course, or do you still encourage them to have that bedside experience or that inpatient experience or outpatient experience before they move on to healthcare IT, right? Is that correct?
Yeah, but also for high school students, volunteering. A lot of organizations have volunteer programs that will give you the opportunity to see, is this a field that I want to get into? Just like with nursing, you can start as a unit secretary, and I started that way. And as a unit secretary, that also started me as a super user for the different clinical administrative areas with the system. And so I got that experience, and that helped me move right into nursing, and it was just a nice transition. But it definitely, you'll know by volunteering if healthcare is definitely the field you want to get into, actually being into the environment, because TV makes healthcare look beautiful and but working and seeing what everybody does day to day.
So in fact, we have an ROP program here at City of Hope. I think we've started interviewing high school students, and we'll see. I'll talk to Jason here if we can put a student there and see how CIS or in clinical informatics. I'll talk to Janet as well if we can bring in a student. Okay. Well, I don't think we have additional questions, but again, do know that this will be available online or on the City of Hope YouTube channel. So if you're unable to join us today or was not able to finish the 1 hour session, it would still be available via YouTube. We'll share it to our networks as well after the session. Well, thank you everyone for taking time out to join us today, our clinical informatics team or CIS team. And you don't see Aggie, but we have our technical person here from HR. Thank you so much. We really appreciate your help today. Again, do connect with me on LinkedIn so that you learn more about opportunities at City of Hope. I'm also on Twitter at SGAOR. We have a nurse tweet chat as well. For any one of you, we can share that. You can share it with your network as well. We have a tweet chat for nurses opportunities here at City of Hope. It's every 4th Tuesday of every month, 3 to 4 p.m. Well, thank you for joining us, and good evening to everybody.